Hello, I am Samantha Simpson, and today I'm so excited to be talking to Kayte Tuyo. She's a pelvic floor physical therapist in Indianapolis, Indiana, and she's also a Bowspring student. I am so happy to have you, Kayte. Would you like to share with us a little bit more about yourself and how you got into your profession?
Absolutely. Yeah. Thank you for having me on, Samantha. Yeah, as you said, my name's Kayte Tuyo. I've been a pelvic floor physical therapist for 7, 8 years now. And I started out my kind of career in training in athletic training. And that's what I studied in my undergrad. And I knew I was going to go on to to physical therapy. And I thought I would end up more in like the sports medicine world. But just slowly and surely had like introduction to pelvic floor physical therapy, and it continued to pique my interest. First, when I was in undergrad, one of my professors at Purdue brought in a guest speaker who was a physical therapist and was in pelvic floor physical therapy to just teach us more about like the pelvic girdle and SI joint and low back pain and different pieces. So then I ended up doing some shadowing with her before PT school. And then in PT school, we had some lectures and some introductions, and it continued to pique my interest. And I, on each of my clinical rotations, just made it a point to go and do some days shadowing with pelvic floor PTs. And then my last internship that I had in PT school was with someone who did a lot of work, again, with the pelvis, with the pelvic girdle, the SI joints, the low back, the abdomen, and visceral work, but didn't have direct pelvic floor training. And so I knew that we were missing that piece of the puzzle for quite a few of our patients. And so after I graduated, I made it a point to take a level 1 pelvic floor course. And I had said, if I love it, I'll continue in it. And if I don't, I'll at least not be ignoring that piece of the body. And I'll have that information and that background to really look at the whole picture and the whole body. And I loved it and I continued in it. And I've been, practicing both in, pelvic floor and orthopedic world and really treating the whole body since.
Okay, so you do both. You do sports and pelvic floor. Tell me a little bit more about what attracted you to Bowspring. So you've been practicing for probably 2 years now, right?
Yeah. Yeah, I was first introduced to it just through somebody I follow on social media. And it kind of, piqued my interest in how she kept talking about really like the open frame posture, and especially like how that is like open through the pelvis. And then, yeah, when I was at the Playful Soul, I started going there. I had seen that you were there and the other girls at my practice. We all were kind of, hearing about Bowspring. And so I was like, hey, I know somebody that teaches that, or I know there is somebody that teaches that in Indianapolis. And so that's when, yeah, we kind of set up an introductory kind of one-on-one with you to learn more. And then after that session, I was like, oh, yeah, I think my body really likes this and likes this movement pattern. And I want to explore this more. And so then that's when I started coming to your Tuesday classes then. And I would say for me, it's just been, yeah, a really beautiful practice for my body that I know that my body really, really likes, and really just bring me back to that more open frame. And I love the open pelvis and really getting that untucked and open. And the other thing with that is the open rib cage and the expansion through the ribs and through not just like through the side ribs, but the back part and the back ribs as well. And how that creating space there also creates space in the pelvis and for the pelvic floor to open up, and that they're mirrors of each other. And so I really feel that in my body and feel that expansion and that openness. And then it's something for me as well that the more that I've practiced in Bowspring, that I'm able to take pieces of it and pull it into my practice in pelvic floor physical therapy for my patients as well.
Oh, wow. You just gave me chills. And answered probably the next three questions that I had on my list. So, wow. I knew that interviewing you would have a lot of impact. And I know you're soft spoken in class, but I know you know so much. So I'm just thrilled to have you share your wisdom with us. And wow. So in your opinion, what would you say is missing from traditional pelvic floor physical therapy?
Yeah, I would say a lot of times traditional pelvic floor physical therapy can be really kind of isolated and focus just on the pelvic floor or just on the pelvis. And that's where I believe that myself, as well as the other women at my practice at Vitalize, really take that like zoomed out and approach it looking at the whole body and the whole person, because we can't just look at the pelvic floor. It doesn't work in isolation. And then I'd say the other piece is that, not all pelvic floor physical therapists, but I think especially even just in like the culture of pelvic floor physical therapy, we just hear like Kegels a lot. And so sometimes I think people think that's like the main focus of it, and it's absolutely not. And in fact, like I rarely prescribe like Kegels as somebody for an exercise for somebody, because a lot of times there is too much tension and tightness in the pelvic floor that is contributing to somebody's dysfunction or symptoms that they're having. And so we have to really, again, work on that open, lengthen, expansion, relaxing, releasing, creating that expansion through the pelvis and not just a contraction.
And just to clarify, a lot of women ask me, they're like, I need to tighten my pelvic floor. Do you get a lot of people saying that too? They're having incontinence and they think, oh, I need to tighten, I need to squeeze, I need a Kegel.
Yes, absolutely. I'd say that is something that we hear a lot for, yeah, people that come into pelvic floor physical therapy and they think, just because, especially you've mentioned the example of leaking, they're leaking. So my pelvic floor must be weak and I need to tighten it. I need to strengthen it. And so then that's when, we have our discussion and any other symptoms. And especially if they're telling me other symptoms, I might already start to cue in of like, actually, we might find that your pelvic floor is already too tight. But then when we do all of our assessment of the whole body and of the pelvic floor, a lot of times that's what we may find. And then we can go through into further explanation of how you can still have that leaking and incontinence even with a tight pelvic floor. Because if that pelvic floor is, again, just so tight and kind of contracted up and has so much tone, we can't have good resiliency where that pelvic floor can lengthen and expand and can move with us when we jump or we cough or we sneeze. And we need that kind of like a trampoline. We need it to be able to like lengthen and have that movement, both downward and upward. And if we're kind of stuck in that really tight phase, we don't have that real kind of resiliency and pliability to the pelvic floor, or that it's just, there's not coordination there because its parts are too tight or too stuck, or we don't have that, again, just kind of awareness and motor coordination to our pelvic floor. So sometimes it's a matter of working those pieces along with helping things relax and create that openness too.
What do you think is the reason why people lose this coordination or they start having issues with their pelvic floor? It kind of seems like we hear it so much these days. Is this a new phenomenon that is just happening in our day and age? I mean, there's more pelvic floor physical therapists everywhere nowadays. Is this new?
No, it's not new, but I would say that there's just maybe more awareness to it now. There are more pelvic floor physical therapists available. With social media, there's a lot more people sharing on their platforms and educating. And in fact, that's how sometimes, I'll get patients that come in that they've just learned about pelvic floor and pelvic floor physical therapy through Instagram or social media or YouTube or things like that, and just more people talking about it, which I think we still need even more of it because there's still a lot of women and men and all people who are struggling with issues and dysfunction through their pelvic floor. Not new. And I think there's so many contributing factors to it. Certainly pregnancy and carrying a baby and birthing a baby, whether it be vaginally or through a cesarean, have a large impact on the pelvic floor. But then even outside of pregnancy, just the way, we're sitting all the time. Again, we are that kind of tucked pelvis. You can walk around and see lots of people who their bodies are just in that really tucked frame and tucked under. A lot of that comes from like the nervous system. A lot of us are living very dysregulated lives and through the nervous system and kind of in that fight or flight stance, just to the way that we're so go, go, go. And a lot of stress and just a lot of factors in our life. And so then our body will kind of get into that again, like tucked, like just like an animal kind of tucking their tail under. And so we see that a lot through the pelvis, and that creates again a lot of tightness and tension in the pelvic floor and weakness in the glutes not being utilized. So that certainly feeds into it. And then yeah, just so many other factors. I mean, we can have everything from hormones affecting it. So throughout a woman's lifespan, and different, those different changes, and how that affects it, whether it be just naturally occurring, having your menstrual cycle and perimenopause and menopause, or adding in synthetic hormones with birth control and all sorts of pieces. And that affects what the pelvic floor is going throughout our life as well. Yeah, a lot of factors.
Hormones affect the pelvic floor. So you mentioned birth control, hormone replacement therapy, even the fluctuations from one moon to the next, and from menarche to menopause. Well, can you touch a little bit about how that affects our pelvic floor?
Absolutely, yeah. So our hormones, especially like estrogen, play a big role in the pelvic floor, and that just the like tissue kind of integrity into the pelvic floor, whether it be kind of the muscles, like the suppleness to them and kind of their plumpness, as well as just even the collagen and the connective tissue as well. So that's where we can see even just again, like you said, fluctuations and change throughout the cycle, especially if somebody has any sort of like prolapse or pelvic organ prolapse type symptoms. It's very common to see that change with your cycle. And as we are having our bleeds start and all those kind of hormones come down and kind of drop down real low, then we can really feel maybe more symptoms from that at that time, more heaviness, more pressure, things like that. As well as, again, then, for example, like postpartum, again, another time where everything really comes down really low. And so we can experience more symptoms then, more dryness, more just irritation, maybe more pain with intercourse that are linked to the hormone pieces as well. And again, you see that then in perimenopause and menopause as well, because as everything, as especially estrogen and the rest of those hormones are just really coming down to a lower level, they can affect the tissues. And again, we could have more painful intercourse or even more urinary symptoms, because that estrogen really affects like our urinary tract as well. So we could have maybe more like UTI type of symptoms or more incontinence or leaking and things like that. And that can also be from the decreased estrogen as well at those times.
That's fascinating. I don't think a lot of people know that. I want to go back to something you started on earlier as the ribs as a mirror to the pelvic floor. Can you elaborate on that and also touch on the feet as a mirror to the pelvic floor and also the throat?
Yeah, absolutely. So yeah, that pelvic bowl and the rib cage and the ribs are really, like I said, they're mirrors of each other. And a big part of that connection comes from the diaphragm and pelvic floor connection. So our diaphragm lives at the bottom of the rib cage, and our pelvic floor lives in the pelvis, right? And they should work together in this pistoning motion up and down. And so the diaphragm is kind of the top of our core canister through the abdomen and pelvis, and the pelvic floor is the bottom of that core canister. And so super intimately connected there. And then again, when we can find that movement and expansion and through the rib cage, we can see that mirrored in openness through the pelvic floor. And so anytime we're working with the pelvic floor, we're working with the breath because of that connection. And the other piece to that is, again, pressure system, right? A pressure system exists between our thoracic cavity and our abdominal cavity. And so again, if we're really immobile or just like really tight, or we are kind of we're stuck into one position through our ribs, then that can create more downward force and more downward pressure onto our pelvic floor, because that pressure has to go somewhere. Versus we can find that expansion, and especially, a lot of us don't expand or breathe into the backside of the rib cage, and that can be really just a very immobile kind of piece without good dynamic movement and functional movement there. Then that pressure can, again, if it can't go out and around in 360 through the rib cage, it has to go somewhere. And so that's where, again, we might see more downward pressure onto pelvic floor, onto pelvic organs, creating maybe more symptoms or more challenge or more overwork at the pelvic floor.
Oh yeah, totally makes sense. I want to talk about traditional pelvic floor physical therapy, if I might call it that, or rather layman's pelvic floor physical therapy that you see on Instagram, is to always talking about don't let your ribs flare, don't let your ribs flare. How is that different, the rib flare different from the rib expansion that we do in the Bowspring?
Yeah, so I would say rib flare is a little bit more, a lot of times we see that in the lower ribs through the front, maybe the sides, where they're really kind of in that flared out. And a lot of times I'll talk to patients about it in like a really, again, like more of a like stuck pattern. So they're flared out and they're staying there, right? Like when we exhale, we move, like they're just kind of really stuck and staying there. And sometimes, again, we might see that with like pregnancy and expansion. And if we aren't getting the rest of the ribs moving, that those kind of get a little bit stiffer or stuck and flared out, or that we are kind of, if in exercise, we're kind of not stable and not activating through the rest of our rib cage or back card, or maybe it's mid core, and we're just allowing those to kind of really just protrude out and collapsing through the back. That might be the rib flare that we're seeing, versus in the bowspring, where we're finding that expansion through the sides, through the back and the front, and we're expanding all the way around. And we might emphasize one side or the other based on, a certain move that we're doing, but it's a kind of more of a 360 expansion and opening all the way around, versus a stuck into this like just forward flare and collapsing through the back that we might see with that rib flare in a more what people are talking about on social media or things like that.
To go on a little bit deeper level, what emotional or energetic patterns do you see often tied to pelvic floor tension?
Absolutely. There can be so many pieces with that. I would say when we have a lot of that, again, like tension in the pelvic floor, sometimes it can purely be just, again, like I mentioned, just that stress. Like if we're just constantly living in the stress and in the go, 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 and a lot of us, have times in our lives when we're just, you just have to keep going, and you're just in that fight or flight, in the high cortisol, and just we have that just increased stress and just tension overall. That might just help, that might create some of that. Certainly, if we have more anxiety or more worries throughout the day and things like that, can also contribute into the pelvic floor. But then we can certainly get into deeper pieces where, if we might hold like deep shame in the pelvis and in the pelvic bowl, any kind of pieces around like because that's more of our, again, like our sacral chakra and kind of area. So things around our fertility, our sexuality, even like creativity, if we have stagnation in any of those areas. Certainly if we've had any times of more like abuse in our life or things like that, that can be really stored and held and stuck through there as well. Even a lot of, especially again, if we talk about fertility and maybe somebody who's been on a long fertility journey, and there's a lot of grief in that, or we've had miscarriages, or we've had loss, or we've had just, inability to conceive when we want to, or abortions or different things like that. There can be a lot of grief that is in the pelvis and the womb space there as well. So yeah, it can be a many different emotions and many different pieces that can be held. But I would say it's definitely a place in the body that is very common to have emotional or energetic pieces and elements that are tied to it, and not just a purely physical or musculoskeletal avenue. And when we're treating and when we're working on the pelvic floor, definitely an area similar to, I was with patients at Kayte Tuyo, because most people are familiar to like feeling like, oh, I feel like I carry a lot of stress or tension in my shoulders or in my jaw. I think those are places that people correlate that a lot with, and then bringing that and educating them on, again, like how the pelvic floor can also be a piece to that, where, at a subconscious level that is there even without us thinking about it. And one of the things that we start to work with on patients is just awareness to that, and just bringing awareness to their pelvic floor throughout the day, and moments that they can check in, or that they start to catch themselves of like, oh my gosh, I'm just tensing up here and I'm so tight here. And then just that awareness is the first step of noticing it, and then relaxing it, releasing it, doing some of those breaths to the pelvic floor, shake it out, untuck, all those different pieces. And it starts with that awareness of just noticing where we might be holding that tension.
That's totally true. And I know that in myself, where before I even thought about the pelvic floor, for years, I was sucking in my belly and holding in my pelvic floor all day long.
Yeah.
And I didn't know that I wasn't supposed to, and I never even thought that I was. And now it's changed with my consciousness practice and my Bowspring practice that I will be aware when I actually do tighten up, and I'll notice like if a car speeds past me on the road, that's when it's going to happen. Or through certain times of my cycle where I'm going to feel some heaviness and I'm going to hold to counteract that heaviness. And then I'm like, can I breathe through it instead?
Absolutely. Yeah.
But most people don't even think about this unless they've had a reason to go down this path. What do you think are the biggest misconceptions you hear about the pelvic floor in your practice?
Yeah, I think one we already touched on of the, I'm leaking and I need to strengthen my pelvic floor. I need to tighten my pelvic floor. Again, we have a lot of people that come in that think that their pelvic floor is really weak or really loose or things like that, and they need to tighten it. And so I think that is one of the biggest misconceptions is that.
Does anybody actually need to tighten it and do a Kegel?
I would say again, there are times when I do work with like a Kegel, and I would say that's more so somebody who where say in an assessment and we're checking on that strength. Can we do a Kegel? Can we do that contraction? And we're not getting hardly anything and not much. And so again, a lot of that really comes back to just like connection and motor coordination and control. And can we find those muscles? So sometimes I do work with a Kegel in those instances of if we just have no connection and we're just trying to get those muscles like online, so to speak, then I'll work with a Kegel sometimes just to work that piece, but not something that I work a lot with. More so if I'm working with it, I'll find maybe that again from a coordination piece, like somebody only has access to maybe like the posterior or backside of pelvic floor, and we're not getting any of like the anterior wall engaged. So maybe we do some different tips and to get that anterior wall online to begin with, and then we move to more functional pieces and whatnot outside of just an isolated Kegel. But yeah, so I would say that's one big misconception is that, again, a lot of people think we need to do Kegels and we need to tighten when really the majority of the population needs to find expansion and let go and release through the pelvic floor. And then, yeah, I think another piece, a big misconception is, I don't need pelvic floor physical therapy if I haven't had a baby, because I think a lot of times in it gaining more popularity, pelvic floor physical therapy, it's definitely a lot around pregnancy and postpartum. So I think that's a big misconception because, again, there are lots of people that would benefit from pelvic floor physical therapy who have never had children or are far removed from having their children. And then I think also along those lines, a lot of people think that they need to wait till after they have a baby to receive pelvic floor physical therapy or to come, when really it can be very beneficial before you're pregnant and even during your pregnancy. So we see and treat both of those populations. It can be really helpful in preparing their body for conception and preparing their body for carrying a child and birth and that really postpartum time. So you don't have to wait until after you've had the baby. And unfortunately, again, I think sometimes that comes through in communication, even from providers sometimes, where, they'll tell their doctor, their OBGYN or whatnot, that they're having some sort of discomfort or leaking or things like that during their pregnancy. And I've had patients who have said that, the response back from the provider was that, oh, once you have the baby, then that will go away. You just have to wait till you've had the baby. That happens during pregnancy or things like that. And that's unfortunate because there are certainly things we can do during pregnancy to help, and we don't have to be in pain or leaking, all the time or feeling all this heaviness or pressure or whatever it is, and just wait until we have the baby. We can help beforehand. And I would say similarly afterwards, I think another big misconception, I like to use the phrase of common, but not normal. So a lot of times, again, may have, bringing back to have a baby, we may have some incontinence after we give birth, or we may have pain during intercourse or things like this. Again, a lot of these things can be common, but that doesn't mean they're normal, and there's things we can do to help. So I think a lot of times we just kind of, again, I think it's getting a lot better, but especially before pelvic floor physical therapy was more relevant and known, it would just be like, you might be chatting with your other friends who have also had kids, and everybody's just talking about how they pee their pants now when they sneeze or when they jump or when they run with their kids. And it's just like, oh yeah, we've had baby, that's what happens now. And again, common but not normal. So we don't have to normalize that as now this is the life you have to live, or that, now sex will always be painful, or all these different pieces. There's, again, things we can do to help to improve that, to improve your quality of life, and to improve your ability to run and play with your kids, and have pleasure and not be painful, and all those pieces.
Thank you so much for all of this valuable information. I want to ask you to end if there's anything else that you'd like to share with us that we need to know.
Good question. Again, I think, especially with my practice with Bowspring, that I would say if we could all, again, just even starting with, like we kind of talked about, bringing that awareness to our body, to our pelvic floor, and even not just the pelvic floor, just awareness to our body in general, right? Because there's so many times and so many of us that are walking around where we're just really disconnected to our body. So I think it's so great to have some sort of practice in your life where you can just drop into the body and kind of just really get to know your body and bring awareness, bring connection to your body, so you can start to notice areas of tension or tightness or collapse, or any of those pieces. But especially with the pelvic floor, just being aware of, I think, that like that tucked posture and that tucked under posture. And the more that we can, even just the simplest change there, the simplest awareness, the simple just cue to really kind of open and untuck and send those sit bones back and wide and untuck the tail, even that alone, I think, can do wonders for so many people. Because, like I said, I would say the majority of the people that walk in are in that tucked under posture. And so if we can just all open up through our pelvises, we'd all be in such a better place.
Thank you so much, Kayte. I've enjoyed this thoroughly, and I appreciate for you all watching. Please leave your comments or questions down below, and we'll hear from you soon. Bye.
Thank you.